if you're ejaculating to escape from your reality, that's not a healthy practice. If you're ejaculating as an expression, way more, the intention is different, your interaction with it is different. That's a much more powerful use of your bodily fluids and energy than like, hey, I'm going to go jerk off because it's 11:30 night, I'm bored, I don't know what else the fuck to do, right? Like that's where I think the problem is, not ejaculating itself.
Hello, friend, and welcome to the Sex Upgraded podcast, a podcast for men all about sex, where we'll combine real, authentic, and down-to-earth conversations about sex, life, and relationships with some pretty wild personal stories and practical how-to episodes as well, with guest experts from around the world to help you have the most amazing sex life you can possibly have. My name is Taylor, and I'll be your host on this journey, and it's my goal with each episode to give you practical, actionable things you can start doing today to improve your sex life and your entire life, because a thriving sex life will help you thrive in all areas of your life. So let's begin today's episode by starting with a deep breath in through the nose into the belly together. Exhaling with an audible sigh. And let's get into today's episode. Today we are joined by Dr. Jonathan Brajtbord, a Western medical doctor who is a practicing urologist who is also a men's coach, and he kind of has both of his feet in two different worlds in this really interesting, inspiring way that made me really excited to bring Jonathan on the podcast. And I first heard him on the Sacred Sons podcast, and there was really inspiring and thought-provoking conversation. And I thought, you know what? I want to have a conversation with this guy. So thank you so much, Jonathan, for showing up here.
Yeah, you're so welcome. It's great to be here. Thanks for the invitation, Taylor.
Yeah, absolutely. My pleasure. And I'd love to start off with just jumping right into it with a question for you. You have your feet
Let's do it.
in both worlds. You went through medical school, the Western medical school, and I've heard you talk about how a big interest of yours is seeing the difference between what you were taught in medical school and then what is actually useful for working with men. And I know this is a huge topic we could talk about for hours, but are there some bullet points that stick out for you?
Yeah, I mean, it's so interesting, right? When I finished, right? So I did my training 5 years of medical school. So I took an extra year and did some research in medical school. Mm-hmm. And then my residency was 6 years. So that's 11 years of post-college studying and training and learning. And when I finished, I was like, all right, I'm good to go. I know everything. We're all set. And then it's like how I practice medicine and how I interact with my patients has really evolved and grown over the last, say, 6 years or so that I've been in practice after finishing my training. Mm-hmm. So, I really believe that, and, research has shown and studies have shown, like, the emotional part, our emotions play such a huge role in our physiology. And like, that wasn't touched on at all, whether it was in medical school or in my training, right? And like, it's a small snippet of like, I'm like, well, people would come to see me. I'm like, well, has anyone asked about like their stress? Has anyone asked about like, how are they feeling their life? They're like, no, why would we do that? I'm like, well, they could impact what they're coming to see you for, right? That's like erectile dysfunction, pelvic pain, testicular pain, right? All of these emotions are playing out. And like, yes, there's like Western medicine treatments, but in my opinion, if you don't address the underlying issue, we're just smacking Band-Aids over Band-Aids. And it's like no one actually feels better.
Yeah.
And I think medicine is evolving and the patients are evolving and they're much more savvy and they're much more research around. They don't just inherently say, whatever you say, doctor, whatever you say, you tell me what to do. Like, I actually don't like those patients, right? I much prefer the patients who come with their own ideas because they have some intuition to their own body and to their own life. And then we can work with it, right? It's like, then as long as they're open to hearing different perspectives or alternatives, as long as I stay open to that too, right? Because sometimes I get closed off. As long as there's that type of relationship, like, I think the sky's the limits for how we can learn to grow and evolve in that kind of doctor-patient relationship. So yeah, I mean, it's like, it's amazing to me how little I actually know and how much more I have to keep learning. in this process. And that's true in the men's work stuff. That's true in my Western medicine doctor world. And like now trying to bridge those gaps is even more so.
Yeah.
So it's been a fascinating journey in those experiences.
Beautiful. Well, and I think journey is the appropriate word, right? Because if you stopped learning, that would be a great disservice to everybody.
Yeah. And maybe it's like my own perspective on it, but like I assumed, right, that once I was done, that would be enough.
Yeah.
Right? Once I was done, that would be good enough. And sure, like we have to take like our continuing medical education credits and all that kind of stuff, which like is good, but it's not, it's more like review of the past and less about like different topics and different alternative treatments or therapies. And it's like, that's more where I like to spend my time, or now trying to focus on, less about like reviewing the old stuff from that physiology that I learned like, 10 years ago.
Right. Got it. So there's a couple things that really stuck out for me with what you just shared. One of those is this emotionality piece. Like I work with a lot of guys too, but specifically in the realm of sexual function, sexual happiness, etc. And a lot of guys are like, give me the one technique that I need to do with my pelvic floor to optimize everything. And I'm like, cool, I could do that, but I actually can't do that because there's so much more going on here. And if you're actually mad at your partner and you haven't talked about it, like that's going to impact things way more than any sort of Kegel or reverse Kegel or whatever, So
for sure.
Nice.
It's just fascinating. Like what men, I would say, in our Western world, they want the quick fix.
Totally.
Right? They want the light switch. And that's what we've been kind of conditioned to have in our life. And so, of course, we're going to apply it to everything, whether that's like our stress, our anxiety, sex, you name it. That's what they want. And the reality is, as you said, like it's so multidimensional, right? And I see it with like libido as well, too. Guys coming in being like, I have no libido. My testosterone must be low. I'm like, well, maybe, but there's a whole lot of other components to like how you feel towards sex in yourself, your partner, your life, your work. All of it plays a role into your desire for sex. So you're just like scratching the surface of this here.
Yeah. The other piece that stuck out to me is you seem like you're approaching your medicine practice in a way that's very open to a lot of other perspectives, open to men's intuition, open to their desires, open to their interests. I remember years ago, I went to a urologist and asked him about something going on with my penis. I was terrified because nobody taught me, about how everything works. And turns out things were fine. But at the end, while he was walking out of the door, he said, you should really get a circumcision because women like it more and life is just better with one. Then he shut the door. And I was like, what the fuck? Really, dude?
Yeah.
Ouch. And wow, you're operating in such a rigid model, So,
yeah.
Let me just drop that bomb for a second.
No, it's so true. I mean, I don't know. I think circumcision is also one of these like really hot topics and it's really controversial. Yeah. And like, no one should ever say that to you, or like no doctor, male, woman, GP, urologist, anybody should, in my opinion, treat patients like that. Yeah. Right. And I say, unfortunately, it probably happens more often than not. These are kind of offhanded comments that physicians make towards their patients that like carry this huge weight. And like to that doctor, right? Like that was probably just an offhanded comment that he didn't mean anything by, flippant, kind of passing. But the reality is like that has stuck with you for how many years?
Yeah.
Right? Like that interaction and that statement that he made, it's kind of like, what the fuck? I really, it's so interesting. Like when I try to like bring the men's work world into my medicine practice, right? Like I had to learn how to hold space in the men's work world. And so often and not, all I'm doing for whether it's men or women in my practice is just holding space, right? How do I actually be present? I don't bring a computer into the exam rooms. I bring a sheet of paper and I start off like, how can I help? Right? And it's like, I leave the door open and I just sit and hold space. I can remember what you said. I'll jot down some notes, but like my attention has to be on you. Like it's going to get the conversation going much more deeply, right? There's more trust inherent to that. And like, you're going to divulge way more things to me that are be insightful into what I think is going on or how I can help guide you as the patient to whatever it is that we want to get to. So it's like, I just hold space and it's amazing how men and women, they never go to the doctor and feel that, right? It's always like typing on the computer and no one's looking at you. And like, I can do that, but that's not in fulfillment for me. It's not fulfillment for you as a patient. And so the conversation gets so much more rich and the conversation gets so much more in depth when you're able to hold space and actually have that interaction. So that's what I try to do. And some days I'm better at it than others, but I think I'm better than most on even my worst days. So it's like, I hold some credit to that.
Yeah. Well, it's the attempt that matters, right? People can feel the attempt, I think. And without putting you on a pedestal, I just want to say thank you for doing that, because I think it's probably helping to reframe people's experience of medicine. And I know a lot of people are having not that experience, and they go in and they encounter this sort of rigid system where somebody's not really listening and they're just prescribing things and checking the boxes. So thanks.
Yeah. Yeah. You're so welcome. It's, my father's a physician and he practices his art of medicine in a really unique way. And I got to watch that when I was in college. I like interned in the hospital and got to like go around and see surgeries. My father's an anesthesiologist. And I watched him interact with his patients, and he was so focused and so devoted just to their experience. I'm like, oh, how do I do that? How do I learn how to be that attentive? And it wasn't really through I was done training that I could find my own path and own rhythm to that. Yeah. So it's an art, right? That's what, I was taught in medical school. It's the art and science of medicine. Yeah. So beautiful. I like the art side of it.
Yeah. It's all valid and all useful. So there's some things I want to get into with you today. First, I just want to mention, we did speak briefly on the circumcision piece. There was a good conversation between you and Adam on the Sacred Sons podcast, so we don't need to repeat that here, but I'll link to that podcast in the show notes if anybody wants to hear some more about that. It looks like maybe you wanted to say another thing about that.
Yeah, it was so interesting when the conversation with Adam came up about circumcision. And, one thing that I actually reflected on for a while, and I didn't say it, so I'm Jewish. And so it's a big part of my, religious cultural tradition to do that. And not that I have a regret in circumcising my son, because I don't. However, if I wasn't Jewish, I don't think I would do it. And I think Adam and I kind of talked about that. I never really shared that piece of it. So I'll leave that there. You can link to the podcast if you want. Yeah. But it was interesting kind of thinking about that full circle. And actually I did my son's circumcision, which was kind of crazy as like a Jewish custom and tradition. As a physician, I could do it. It was a beautiful experience. But it's not for everyone. Yeah. It's definitely not for everyone. It's not.
And in a different conversation, I would want to ask a lot of questions about that to just understand the belief system more. But I want to get into some other things today. And one of those things I want to get into after some other topics is to talk about your relationship, because you've been in a monogamous relationship with your wife for, I think you just said you've had your 12th anniversary this past weekend, which congratulations. Yeah. That's awesome. And you have 3 children, which is beautiful. And I do want to get into that because I think that's beautiful, treating monogamy as a practice. And I want to get into a couple like nitty gritty things about sex first, though, if you're open to it.
Yeah.
So
absolutely.
Yeah, this is the realm that I focus on a lot. It's like, how does sex work? Ejaculation, non-ejaculation, orgasm, non-orgasm, erectile dysfunction, etc. And so part of that is I like to try to read as much research that's out there. And I also have opinions that some people agree with and other people disagree with. And I'd be curious to ask your opinions on these. And I have no attachment to you telling me I'm right or wrong. I'm just generally curious to hear your opinions on them.
Sure.
So one of my opinions is that I think most men ejaculate too often for their own good in terms of using it as either a coping mechanism or a release, when there could be other ways that they could experience release that might be more optimal for their health. And part of that belief is that if a man doesn't ejaculate as often, then he might have more mental clarity, more motivation, more drive, etc. And I'm curious if you've encountered this belief, if you are aware of it, if you've talked with your patients about it or not, and just kind of like what your thoughts are. And again, if you tell me I'm full of shit, like that's totally, I'm here to hear it,
No worries. Actually, I completely agree with you. I think that men use, and I'll speak for me personally in the podcast in this container here, I think I sometimes use, and I think a lot of men use ejaculation as a stress reliever, right? It is a means of escape. It's a means of releasing stress, not facing the shit that's going on. It's way easier to do that than like go for a workout or go push your body physically. I think that I have seen in my own life the times that I have abstained from ejaculating, a lot more like energy, a lot more like drive, whether that's like professional stuff or sports athletic stuff. There has been that. And I think there's a, again, it's a practice, right? I don't know of any literature out there that supports it. I don't know how you even start to measure that, whether besides like, different surveys and things like that. And I think for men to start looking at that practice, I talk to my patients about some of it relates to porn, right? Because some guys will come to me with like some porn use, overuse, and how they don't feel sexually fulfilled in their own relationships. And the first thing I ask them is like, what's your relationship to porn, right? How often you ejaculate into that? Because again, that's not real life, right? I don't care like how real it seems to be. It's not real life. And so I'm kind of go off on a tangent on porn, but great. For ejaculation, right? If you're ejaculating to escape from your reality, that's not a healthy practice. If you're ejaculating as an expression, way more, the intention is different, your interaction with it is different. That's a much more powerful use of your bodily fluids and energy than like, hey, I'm going to go jerk off because it's 11:30 at night. I'm bored. I don't know what else the fuck to do. Right. Like that's where I think the problem is, not ejaculating itself, right? It's what's the intention behind it.
Can you speak more to the ejaculation as expression piece? What do you mean when you say that?
I think some guys don't know how to process their emotion, right? Whether that's like their stress, their anxiety. And so when men can ejaculate, right, it's that stress reliever. It's that getting whatever is bottled up in them out, as opposed to creating more of a healthy dynamic to process those emotions, going for a run, working out, hitting a boxing bag, right? Like actually getting that aggression out as opposed to releasing it through ejaculation.
Got it. Thank you. That's cool to hear.
Yeah. So I'm in with you. I'm with you on it.
I didn't know, but here we are. So in your perspective, then, are you aware of, or do you encounter ever patients who experience problems because they've gone too long without ejaculation? Do you ever prescribe ejaculation to people?
I've never prescribed it. I have not had a lot of patients come to me with like they're trying to do like semen retention practices and some pain. I have received some like messages on Instagram about kind of questions about that. I think everything's in like a kind of an art, right? So like if you're doing something to the point of pain, no, I don't think that's a good idea. There's also cultures, again, I don't know all of the different cultural aspects, but when you talk about ejaculation, it's thousands of years of people history and these different counters, right? I do, there is an Ayurveda tradition that like they don't want you to have backup of fluids, right? Stagnation of fluids is bad for the body, whether that's semen or whether that's tears or saliva, whatever it is, like digestional fluids that backup create stagnation can create disease. So from that standpoint, there is a belief that, maybe you should ejaculate more often to kind of keep things moving. So, again, what's the balance here? I think everything in moderation, right? Do you need to be ejaculating every day? No, probably not. Do you need to be doing it once a week? If that feels good in your body, great. If you need to go more often, right? I think oftentimes we outsource that as opposed to tuning into what feels good in our body and what feels in alignment and giving the power away, whether that's to a physician, a book or whatever. Like, I think taking in the information is really important, and then sitting with it and feeling how it feels in your own system is really where magic can happen as we integrate what we're learning.
Yeah.
So,
yeah, beautiful. The deep listening.
And it's hard to do, right? We're not taught how to do this. Oftentimes, like whether it's in school or college or whatever, like, right, we're outsourcing that. We like look for the education outside of us, and then we just take it as dogma. I think, you can do the research, you can read the articles, you can read the blogs, you can listen to podcasts and take the information and then practice it and see what fits for you. How does it feel? And then devote yourself to actually an experiential learning. I think there's a lot of power in that.
Yeah. So just to recap, what I'm really hearing you say is, yes, there's value in the research that is out there, but also there's value to be gained from looking at a bunch of different traditions and different theories and practices, and then specifically trying these things and noticing how it actually feels in our body with the practice of deep listening, which is actually really difficult in our modern society when we have 50,000 apps on our phones and pings and notifications, and our attention span is what it is these days. It takes extra effort to be able to do that. And I just want to encourage us all to do that because it's crucially worth it, you know?
Yeah, it's you're so right, Taylor. You're so right, Taylor. It's like, between like the wearable technologies and all the notifications we get, they're like we've lost a lot of the practice of just sitting and listening.
Mm-hmm.
So,
yeah,
more power to people who do that.
Absolutely. So, another question for you is, let's see, do I want to go that direction or the other direction? Yeah, okay, here's one other question. This piece around, and it stems from, well, let me just create a context. So I talk about sex a lot. It's basically all I do on my platform. And sometimes I'll get comments from people like, well, you're a doctor. You actually shouldn't be talking about sex, or you shouldn't be giving people advice or ideas on things to try. And I'm like, yeah, but doctors don't all have the time to do this. And I've studied this shit a lot. So like, yeah, we don't need to go into that direction. But one of the things that I get that a lot from is talking about anal pleasure and anal stimulation and men exploring that. And I'm wondering, do you encourage people to do that as part of a healthy exploration, or do you encourage not that, or do you talk to your patients about that at all?
It's a good question. I'm going to circle back on one thing which you said, because I love your stuff, how the stuff that you put out on social media, I think is really cool because it's, first of all, it's all like backed by research, right? This is not just like you like flying off the top of your off the cuff.
Mm-hmm.
And like, as a urologist, right? Like I'm supposed to be a men's health urologist. No one taught me this shit. No one taught us anything about that stuff, right? Like I went through 6 years of training. Like we didn't talk about semen retention once. We didn't talk about like the physiology of, what that does to your body at all. We learned about the physiology of erections, how that works, what medications do, how to do surgery for it. But like, there's so much else out there. And this is kind of where the point I am now is that like, I need to learn more, right? I need to go and do this stuff. And so more power to you. And the people who say, well, you don't have an MD, you shouldn't be talking about that. That's total bullshit, right? Like in my opinion, for me personally, right? Like just having an MD does not make you an expert in anything, right? Having an MD means you went through a lot of school, and like, that's great. And there's a lot of value to that. And I understand that and I honor that, but there's a lot more to it. So let me preface that because I think that's important to note. As far as anal stimulation, no, I've never prescribed it. I try to, when men come to see me and my patients come to see me for like any sort of like sexual dysfunction, whether it's ED, libido, I try to get them to tune back more, again, kind of into themselves, right? And if that means like that they want to explore that, great, right? Like I try to be that safe space for them to be like, hey, look, this is what I'm trying, this is what I'm doing, but we don't get into the nitty gritties of it. I think there's so much shame around, especially for like heterosexual men in their perineum and in their anus, that there's a lot of shame and guilt there, and it just shuts down. And anytime we have an emotional part of us that's shut down, there's an opportunity to explore and kind of feel what that feels like to engage in that area of our body. No different, right? And so if a guy's interested in it, great. More power to him. So I try to encourage all of that, but I have not given them those specific instructions.
Got it. Yeah, I would imagine that would be a strange thing to prescribe somebody. Like under what circumstances? I do sometimes tell people like, hey, I think maybe you might benefit from exploring this, but it's very different from being like, you should do this 3 times per week for X amount of time.
I mean, it's interesting, like, right? Like most people, come to see me because they want the Western medicine take on stuff. Yeah. And so that's where I start with. And then I try to kind of get them, into the more of the emotional side of things. Yeah. But they have to be open to it, right? I've had plenty of interactions with men when, they're like not open to it. They're like, what the hell is this guy talking
Yeah.
about? And then like, I say, look, like this is me, this is what I'm into. And there's a lot of other urologists. There's more in my practice. You're welcome to see them. Or I'm happy to keep working with you this way too. Right. Like I'm very forthcoming. I try to be me, and if it's going to work, great. If not, that's okay too.
Yeah.
So
you said most people, what do most people come to see you for? Is there a general theme? Is it all over the map? Is there something you're seeing in society today?
It's all over the map as a urologist, but I would say the theme that I see a lot of is men in their late 20s to mid 40s coming to see me with ED, erectile dysfunction, and or pelvic pain, and like low testosterone, right? Like everybody's getting their like T levels checked now. It's a very commonplace thing to do. And like they want their T fixed. And so it's like trying to take a step back and, when it's erectile dysfunction stuff, it's like, all right, like what's your relationship like, right? What's your relationship to stress? How are you processing your stress? And some guys are aware of themselves enough to be like, yeah, like I have 2 kids and like I just got a new mortgage and my job sucks and I hate my life. And I'm like, that's impacting your erections. And some guys are like, it's been working fine for all these years. Now why?
Yeah.
Right. Like that's oftentimes like the guys in their early 40s. It's been fine. Nothing's changed. But why is it working now? And to them, I say, you can't outrun your physiology. At some point, it's got to catch up to you. And so, that's harder for them because they've been in this state for so long. It's harder to get them to start thinking about how do they deal with their stress on a daily basis, and bringing them down, how that helps their erections. Try to make that connection for them.
Yeah.
So those are a lot of what guys come to see me for.
Yeah. Which is interesting because generally speaking, that age range, I guess prior to the modern, like past 10, 15 years or something, would not be the age range that would be typically struggling with that sort of a thing.
No, not at all. Completely. And like, it's a very different pathophysiology, right, of the disease in the guys in their 30s and 40s than the guys in their 60s, 70s, 80s who have, they've been smoking for 30 years, they have high blood pressure, they have uncontrolled diabetes. Like that's a totally different physiology. Yeah. Like there's treatments for that, which helps. But like we don't have, in Western society, we don't have good treatments for the young guys who struggle with anxiety, struggle with premature ejaculation, right? It's like trying to talk with them and figure out where their comfort level's at in dealing with this is challenging because they just, again, want that quick fix. And that's not, as you know, probably as best as me as if not more, right? That's not how it works. Yeah. Getting guys through that process.
Totally. And one thing I like to talk about is, well, one of my courses is 10 weeks long, right? And that is even a short amount of time in the grand scheme of things. But a lot of guys think, oh, I should just be able to focus on sex for a couple of weeks and get it down. But in what other category of life is that how it works? Like that doesn't work that way for anything. Basketball, playing the guitar, jujitsu, like whatever, Yeah.
Like, well, and like, no one taught us, right? Like we ended up figuring stuff out through like older cousins, older siblings, magazines, videos, right? Like that, or sex ed class in like 4th grade. Like what the fuck is that? Yeah. And like the way at least I was taught, like no one taught me how to do any of this stuff. Yeah. And so you just repeat patterns and, suffice it to say, they've not been always the most healthy, male sexual patterns in the last how many thousands of years. So, we're not exactly working with a good foundation here. So it's fascinating.
And then you look at some of the statistics around porn use and it's a little mind boggling. Like people in their early 20s, I think it's over 50% of them say that porn is their main source of education about sex, which is just like mind blowing, mind numbing.
Yeah.
And that could be a whole other 2-hour conversation, but yeah, go for it.
Well, yeah. And these guys I can't get off with my girlfriend. I'm like, well, you're used to gangbangs and like the, Pornhub and like, no wonder you're not feeling satisfied by a relationship with one person at one time. Yeah. It's fascinating. And it's so sad because that's what they're using.
Yeah.
So.
Yeah, no one human can compare with the constantly changing camera angles and infinitely available amount of videos on the internet. Like it's just impossible,
It's insane. And, no one, I've heard you talk a little bit about it, but like the connection through sex, right? And so it's not just the physical stuff that you're getting, right? And like that's what I don't think men understand is all of the emotional, spiritual connection that you can have with a partner, male or female, during that sexual experience. Like that is really powerful. And like guys just skip right over it because we're so obsessed with climaxing, making her climax, him climax, me climax, everybody's up. Like that's what they focus on.
Yep.
Missing the boat.
Yeah.
Totally, in my opinion.
Yeah. So this seems like a perfect segue to go into talking about the cultivation of sexual, romantic, sacred relationship with one person for an extended period of time. This is, I know that the shifting of desire and the lack of interest is something that everybody deals with, but I'd love to, if you're open to sharing some about your relationship and some of your practices. Like you've been in relationship for over 12 years, I imagine, because you just had your 12-year anniversary.
Yeah, Sarah and I have been, so I'm 39. We got together when I was 22. She was 21. And so 17 years. Wow. It's, long time. Yeah. Yeah, we had to navigate a lot of, we lived in New York City in our 20s when I was in medical school. And like we were the only people who like stayed a couple. I heard friends who were coupled and break up. And yeah, it's been a fascinating journey, through in our 20s to 30s having kids and the changes in our relationship that caused, both physically and time-wise and exhaustion and the whole thing. Yeah. And I will say that, speaking for me personally, like I have never had better sex than I have with my wife now. Like it is amazing. And, for all the guys who struggle with monogamy and like, I have a very close mentor of mine who is into polyamory. Like that's totally fine. That's what he wants to do. Yeah. And we talk about this, we debate a lot, and to each their own. I find for me personally that the level of depth and connection that Sarah and I are able to get into because we know that this is our person and our partner, we can constantly are choosing each other is super deep. And, actually I haven't shared this to anybody, I don't think, but back in our early 20s, Sarah had a mentor who was in the polyamory community, and we talked about it for like a hot minute. And I was like, no, I'm not okay with that. And, we kind of talked about why, and for me, what felt good, what didn't feel good. And, we had agreements around like what happens when we go out with our friends and how you can flirt all you want, but there was no physical touch. Like that was our barrier. That was our boundary that we both agreed upon in our early 20s that helped us kind of navigate that landscape. And, now it's, I don't know, I guess I'm talking too much.
No,
but,
it's great. It's interesting because I've had some conversations about polyamory and open relating on the podcast, and it's interesting to me to have an intentional conversation about intentional monogamy. And this isn't to say one is better than the other, but I think this is a very useful conversation for people to hear because the examples of somebody and a couple being really intentional and mindful and treating their monogamous relationship as a practice, like that's, at least in my spheres, there's not very much of that. And I think there are people who want that. And so it's beautiful to hear.
Yeah, thanks. I mean, it's been a practice and it's been a journey for sure. And, I think that in lots of ways, Sarah and I had to, we did, so much like couples therapy and individual therapy, not sex therapy itself, but like, I always like sex is the byproduct of the emotional connection, right? It's not, it doesn't come first. And so we had to work on the layers that we were able to connect with on an emotional level. And that required like opening up and really being vulnerable with each other so that we could understand like where our hurt was, where our pains were, like, right, where Sarah, her, she talks about this very publicly, but her own body image issues and like what I did, knowingly, unknowingly to make that worse, right? Like, and we went through a lot of stuff around that and a lot of healing around that, but I had to own that, right? I had to own my role in making her feel bad about her body and knowing like that was her own trigger. And like, holy shit, did I like feel terrible when I finally acknowledged to myself what I was doing for years. I'm talking years. Like it was bad.
And this is unintentional. Yeah.
unintentional. And the hard part was it was unintentional in the beginning. And then when Sarah would like bring it to my attention, there was still moments where I would fall back into that pattern and I'd be like, fuck, I did it again. And I didn't mean to on many levels. It this the kind of ingrained patriarchal patterns that I had. And so like undoing that really, I think now allows us to have the level of depth and trust that we have to have some incredibly mind-blowing sexual experiences, the two of us, knowing that like we have many more years to go. Like, where else can we go with this?
Yeah.
Right. So it's been really, it's been a practice for sure.
Yeah.
And yeah, very, really beautiful.
Yeah. As any relationship is. And I know from my experience being in multiple different styles of relationship that it's very easy when you're in long-term relationship with one person to experience a dip of attraction. Then all of a sudden the other person in the grocery store is looking really good, and then your friend that you've known for years is looking really good too. And that feels a lot more appealing sometimes than, or at least a lot more easy than navigating back into
Yeah.
the relationship and making the conscious choice, which it sounds like what you
Yes.
did, because you're in this container. It's like, it's putting this stuff up in your face. Like you could have easily been like, actually, I don't want to deal with my shit. Let me go find somebody else. But that would have been problematic for many other reasons.
Absolutely. And I love what you said about that, right? Like it's in lots of ways. That's why for me personally, monogamy is a harder, it's a different challenge, right? And it's a challenge that both Sarah and I are very committed to about that, right? And I love something that I read with David Dita, who I've read and done a little bit of workshop with him, but how like I think the attraction to another individual is inevitable, right? Like I think people can be magnetic, male or female, hetero or homosexual. The energies can definitely be magnetic, and it's like, okay, how do you take that individual and like honor them and see them and like experience them and then let it go? And like there was a lot of that practice for me, especially when Sarah and I were in our lulls and in our dips of like, okay, this person is attractive. I feel her energy. She's, beautiful or, and okay, I can take that in and I can let it go. And that was really powerful for me to know, like, I didn't have to go and act on anything. I didn't have to, or there wasn't like, I could continue to choose my wife and can choose my relationship while like, experiencing that energy.
Yeah.
So it was really beautiful. That was powerful for me.
Yeah, that sounds powerful. And I just want to share a brief personal story that I haven't shared so much, but I'm in a relationship that has been primarily monogamous now for over 3 years, not as long as 17, but we're committed to it and it's great and it's beautiful. And we're buying a house together. So that's deepening and deepening. But we've experienced the nuance of this as well. And earlier this year, in fact, we went through a lull and I noticed myself starting to look at other people and be like, oh, hey, over there. Like, oh, remember Sarah? Sarah is pretty cool. Like all these thoughts. And then I was like, wait a minute. No, actually, I want to be cultivating my relationship with my partner right now. And so what I did was I took a couple of days actually to sit by myself and I journaled and I journaled a lot of questions and prompts for myself. And one of the prompts was, in what ways do I reduce sexual charge in our relationship? Another question was, what roles do I put on my partner that I could potentially get met elsewhere? And it's like, oh, support system, caregiver, food cooker, mother, like all of this shit. And I'm like, oh my God, I didn't realize I was putting all this on her. And some of the other things that I was doing was like, I would sometimes grab her ass mindlessly, in the morning, like, hey babe, and just like touch her ass mindlessly. And what that was doing was it was desexualizing this part of her body that I think is really sexy. And so I made a conscious decision to, hey, back up. And the only time I will touch her ass is if I'm doing so with this level of intentionality of cultivating sexual charge and appreciating her beauty in our relationship. And that's hard because I've built up these patterns, but I noticed the practice of it. It has really done a lot for our relationship. And I continue to practice it, of course. And I continue to find new ways that I'm discharging our sexual connection between us. But I think this is really one of the beautiful pieces of long-term relationship with somebody. And I just wanted to give an example of one thing that I've done and just go for it.
I love that. I mean, it's so, well, what you're doing, right? It's like we get lazy in long-term relationships.
Yeah.
We take things for granted and we get lazy. And so, you're creating intentionality behind those interactions on a daily basis, which is huge, right? Like a practice that Sarah and I do is like we go on weekly date nights every week. And like with 3 kids and 2 careers, like it is hard for us to find that time. And like we are committed to that because we know if we don't prioritize each other, like our whole relationship everything else starts to kind of crumble away. And it sounds so simple, but like we have friends in our communities who they haven't gone on a date in months, years.
Yeah.
And it's just like, how do you exist? And they're baffled that we're able to do that. And it's a matter of priority, right? It's a matter of a priority. But I love how you're able to take a step back and reflect on your own interactions with your partner. It's really cool.
Yeah. And I feel like those are the kinds of things people should be doing, in my judgment assessment, in a long-term relationship. Because we all have our shit. We all have our shadows. We all have our ways that we're unintentionally hurting my partner. I've definitely unintentionally hurt her through behavioral patterns that I wasn't aware of. And she was able to show me, be a mirror and say, hey, you might want to look at this actually. And it was like, ooh, ouch. Wow, I'm doing that. Okay. Thank you for being my mirror. Thank you for.
Yeah. And you have to own it though, right? Like that's the thing. Yeah. You have to acknowledge it and own it. And something else that I think you mentioned was the roles, right? The roles that we put onto our significant other, because that is huge, especially in like long-term marriage relationships with kids. Yeah. All of a sudden, like your partner is like, you see her just as mom, or you see her just as like your roommate who's like the co-parent and not your lover or your wife. And like those roles are super important to identify. And I would say this is a generalization, but like most men, they've never really been initiated into manhood. So they still see their partner as their mom. Like they don't necessarily want a partner. They want a mom who they can sleep with. And it's like, that's all kind of fucked up in lots of ways. And like, edible complex and the whole thing. But like, and in order to like really have a fulfilling, in my opinion, long-term sexual relationship with your partner, they can't be your mom. They can't function in that role. And so like Sarah and I have it's a marriage course that we run. And one of the biggest things we do is we help them get into a better dynamic so that they're not seen as like, coach and mentee and like mom and son. And, it's getting them into the proper alignment, because that's where you can start to really, truly thrive, is when there's the right dynamic there.
So can you give me an example? Because I know it might seem a little abstract for some people, and some people would be like, no, I don't make my girlfriend my mom. Like, that's fucking weird. But what might be some behaviors or signs that you might be on some level associating motherly needs with your partner that might be disadvantageous to your relationship?
Yeah, I mean, I think it's like as basic as, who's doing all the dishes around the house, who is cleaning the house, right? If you just assume that your partner is going to do this, right? Like, what are you projecting onto your partner from your own childhood about how you saw your mom interacting, right? Like, and it's at basic, who cooks, who does the dishes, who cleans, who do you turn to when you need comfort and to be consoled, not like seen and validated and experienced. Like, it's okay to be sad, obviously, with your partner, but what are you looking for in that interaction? Are you looking for just like the motherly comfort, or are you looking to be supported by your partner who sees you for who you are? Those are different interactions, or different emotions. I remember early on in my relationship with Sarah, I was going to medical school, and like Sarah was very early an entrepreneur. So she had like, in my opinion, all this free time, which is like total bullshit. But this is like my perspective of entrepreneurs at the time. Yeah. I'm like, you have all this free time. Like, do you mind, like, when I'm gone up at school, can you like, go get my dry cleaning and do the laundry? And Sarah's like, fuck you, no. And like, that's how our dynamic was, like, from the beginning. Yeah. And so, it's like we had less of that role, but like we see it all the time in patients and in clients that we work with. So it's very prevalent.
Awesome. Thank you.
I'm curious, do you see that in sexual relationships too? In men who in the sexual experiences?
Which part specifically?
The motherly role, like men aren't as fulfilled sexually because are you able to have that insight into that, or not so much?
I think it is something that a lot of guys do. And I guess I'll speak just from my own personal experience. I definitely have put motherly desires onto my romantic partner, who's a woman. And like that
Mhm.
for me, that has come in the form of wanting more cuddles or more cute, like close time or
Mhm.
like nurturing style support, which is beautiful
Yeah.
and nice to experience in the relationship. And also like receiving that kind of nurturing does not foster the erotic connection that I
Correct.
ultimately really want in my relationship. And I know I'm not alone. Like I've talked to a lot of guys who've had that experience and where you have to like circle back around and be like, actually, do you want to be talking all like goo goo gaga doobie 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 with your partner? Like I remember one time I had this conversation with this guy. I was talking to this couple actually, and they would refer to each other as like schnookums and jujuberry and like all these little cutesy names. And they said, "Oh,
Yeah.
we haven't had sex in a long, long time and haven't felt sexually charged." And I asked them like, "Okay, before we do anything else advanced, let's just start with trying." Like, let's not use these names for a couple weeks and see what happens. Like, let's intentionally use language in a way to cultivate the
Right.
kind of relationship you want. And shocker, they started having good sex about 2 weeks later without using these names. And it's amazing, you know?
Yeah, I mean, it's not hard changes. It's just the small changes can have huge impacts. I think
Yeah.
that's the key. And often it's just becoming aware of it and then making these small changes. And that's what I've seen in my own life and, the guys who I work with.
Yeah.
So it's cool.
Looking at the time, I want to move into one other category. Thank you so much. It's been a really
Yeah.
interesting conversation so far. Fatherhood. You
Yeah.
you are a father of 3. Can you remind me
Mhm.
your children's ages?
My son is 9.
Mhm.
My middle child is almost 8. And my youngest one just turned 5.
Mm,
So we had 3 kids in 4 years.
wow, beautiful. That's awesome. Does this feel like it kind of ties in with the marriage piece, but does this feel sort of like a sacred mission? Like I get sometimes undertones of the sacred from your work, and I'm curious. Yeah,
Yeah. Yeah. I mean, so yeah, fatherhood's been definitely I mean, there's no greater teacher than my son. He is such a mirror for me.
mm,
Like, dealing with my own father issues. I get emotional about like dealing with my own father issues. And my dad's a fantastic man, but like, had his own father wounds from his dad that were passed down to me.
yeah,
And yeah, I am committed to being a present and involved father. And my dad was involved, but not always present.
mm,
And I present physically, not presently emotionally, if
mhm,
that makes any sense. Um, and so this has been like a big mission for me to really embrace being a father because when my son was born, I was not ready.
mm,
Man, did I struggle. And I struggled for close to a year before I really embraced being a father and how we could connect and what we were able to do. Um, and since then, since I did that, it's been a beautiful experience, but it was really hard in the beginning. I resisted so much.
mhm.
Oh my God. So,
Yeah,
yeah.
so I don't have any kids at this moment. I'm thinking about it, but not sure, and might get a vasectomy if I choose not to. Which, by the way, there's a really interesting conversation about vasectomies in the Sacred Sons podcast that you did too. But all my close friends who've had kids in the last couple of years, none of the guys have said it has like the first few years are their favorite years of their life. And I think
Yeah.
that's a useful understanding to go into the experience with, you know?
Yeah, absolutely. I mean, and the kids at that time, right, biologically, they don't need the father as much, right? They need the mother.
Yeah,
That's how they survived evolutionarily, right? It was not from the father, but from the
for
mother.
sure.
And so it makes sense that's the case. And I'll say, because of my lack of interest, I'd say, or lack of acceptance
Mhm.
at being a dad, like my relationship with Sarah suffered,
Mm.
which definitely put another layer of stress on an already postpartum depressed, woman who is trying to make money because she supported us through residency when I was never around. Like it was a bad scenario like that we have worked out
Yeah,
over the years, but like it was rough
yeah,
in the beginning. And it's hard. There's no doubt about it. It's hard in the beginning,
yeah.
but it's incredibly rewarding for those who choose it.
Mhm.
At least for me, it's been rewarding.
Yeah. And I'm curious, the world is a unique place the way that it is these days, and your kids will eventually be sexual beings in the world. And I'm wondering, what are some of the most important things you will want to teach them about sex?
Well, number one is consent. I think that is huge. That's a great question. Consent. I think trusting their own bodies and being comfortable in their own bodies. For me personally, I was very uncomfortable in my body starting to get sexual. And I didn't, because of that, it fed into my confidence and I couldn't say no when I really actually wanted to say no, which could be a whole other conversation. But having the confidence to know their own limitations and boundaries and being comfortable with themselves to walk away would be those would be, I don't know if the top two, but definitely top five in there. And just, knowing that like I support them no matter what, right? Like homosexual, heterosexual, transgender, like I want them to thrive. And I consider myself to be very open to that. And I want them to be happy. I want them to be fulfilled. I want them to feel expressed in all aspects of their life, including sexually. And they're obviously too young for that now, but they're starting to ask questions. And we talk very openly about body parts and try to read conscious parenting, stuff on sex and how to talk to your kids about that. But yeah, it's an area that I'm nervous to explore with them, but I'm also really excited to, because I think there's so much room for growth and like what I experienced, in Texas growing up in a very conservative family.
For sure.
Let's say that way.
And what I learned in public school, which was nothing really, other than if you have sex, right. I was literally told if you have sex, you'll get AIDS and you will die. I was just like, good Lord. Wow. So bravo for planning to have the conversation. And yeah, like I was curious, like, do I ask that question? It's an interesting thing because maybe you haven't thought so much about it because of the age of your kids yet, but like we're living in a hyper-sexualized world, so what do you think about?
I know, like, I forget what, it's like some crazy percentage of like 10-year-olds have already seen porn, right? It's like, so now my son is 9, right? Like this is the window that you have to start talking about it. And like, it seems crazy to me. And it's just the reality we live in. So you can either like, la, 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 or you can actually try to get ahead of it and be a resource for them. So they're not asking, YouTube and Siri and all that kind of crap.
Yeah, so for sure. So the last thing, just a couple minutes left here. And you mentioned in that other podcast that you do have a vasectomy. And I remember you said something that really struck me. You said that felt like a commitment ritual to your children and your family. And that was impactful for me, actually. And I wonder if you could just speak a minute about that. Share.
Yeah, for sure. Yeah. I mean, my wife is a priestess, so everything becomes a ceremony. And everything there, when you create a ceremony and you ritualize something, there's a lot more depth and meaning to it. So for me, when I went through mine, I mean, I had done, I've done hundreds of vasectomies and I was still nervous for my own. And so Sarah we sat down and we started talking about like, what am I actually nervous about? What is it that like the fear is there? And there's like the fear of, obviously the pain that's afterwards. And there's the fear of, well, is it going to feel the same? Is it going to be the same? And the reality was for me that like that having this vasectomy was something like I was recommitting to Sarah and my kids. And this is the family that I'm going to have, right? Like these are the children that I'm going to have, no matter, God forbid Sarah dies, God forbid something happens to us and we split up. Like this is my family. And that was really powerful for me as a man to connect with and recommit to. So it was one of the earliest things I wrote up a ritual about it. Like it's on the internet out there. Nice. And it's pretty cool. Yeah. It's I offer it to some patients who are into it. Sometimes because occasionally they'll ask, or sometimes I'll see an opening or feel an opening that they're nervous and looking for a little bit more depth about it. And I offer it to them. And the men who have gone through it, it's powerful for them. It's a way to connect to the deeper meaning of it, and not just like, well, I'm done having kids, like, fuck this, or I can't imagine doing this, I can't afford it. And, fine. If we exist there, that's great. Yeah. But there's so much more richness when you exist below.
Beautiful.
That's where I try to live. And that's where I try to like get out to the world.
Yeah. Thank you. So we'll find that and we'll put that in the show notes for this episode. Yeah, last question. Did you do your own vasectomy?
No. Although I did learn things doing it, like having my partner do it. I was like, oh, okay, I could try this style or that style. So I had a partner of mine do it, but I do get that question a lot.
Good. Well,
So,
I'm happy you did not do that. So thank you
Me
so
too.
much for your time and your perspective and your wisdom. I really appreciate you taking the time to have this conversation. And we'll put links to all of your stuff in the show notes. And is there any last thing you want to share with people? Anything you have coming up? Anything that feels important to share?
Um, what do I have coming up? Well, I mean, you have a co-ed audience, so so my wife, plug for her stuff.
Mhm.
So she's a priestess. She has an online community, online kind of temple called Holy Woman. So that's great. She does an annual retreat in September, which comes up.
Beautiful.
I have a plug for my men's work stuff. So I run a men's course at 6 weeks long, twice a year, once in the spring. We'll do it again in the fall. And then I have an in-person embodied masculine type experience retreat in February on the land where we work with the elements and experience cold and hot and, kind of confronting physical stuff, ways to get kind of guys back into their body. So plugs for those things. I really appreciate the invitation, Taylor. Thanks for reaching out. Happy to do this. And we could have gone into a lot of different tangential ways, and excited for the opportunity to do it again more.
Yeah,
so.
For sure. Thank you. And thank you everybody listening. And if you're watching on YouTube, thank you for watching. If you have any questions, please leave a comment on YouTube and I'll get back to you. And then check out the show notes for details and how to get in touch with Jonathan. Thank you again, Jonathan, so much. And I appreciate your time. I hope you have a beautiful, beautiful rest of your day. Cheers.
Thanks, Taylor. Take care.